Kidney cancer causes and treatment. Kidney or renal cancer is any cancer that involves the kidney. Symptoms include blood in the urine and a persistent pain in the side, but they often do not appear in the early stages. Older age, obesity, and high blood pressure all increase the risk of kidney cancer. According to the American Cancer Society, doctors diagnose around 79,000 new cases of renal cancer each year, mostly before the cancer has spread to another part of the body. There is no single definitive treatment for renal cancer, as it depends on an individual's overall health and the stage and type of cancer. However, treatment may include surgery, immunotherapy, or chemotherapy, among others. Keep watching to learn more about renal cancer, including its causes and treatment. What is it? Renal cancer begins in the kidneys, a pair of bean-shaped organs on either side of the spine behind the stomach. The kidneys filter excess water, salt, and waste products from the blood. They then return the filtered blood to the circulatory system and pass the waste as urine into the bladder. Cancer begins when cells grow and divide uncontrollably instead of in an organized manner. As a result, the cancerous cells create masses called tumors. These tumors can then invade and damage nearby tissues and organs or spread to other parts of the body. The American Cancer Society reports that renal cancer affects 1 in every 46 men and 1 in every 80 women over a lifetime. Moreover, the average age of diagnosis is typically 64 years old. Renal tumors. An individual with renal cancer may have tumors in one or both kidneys. Sometimes renal tumors are benign, meaning they are not cancerous. They may not spread to other areas of the body. However, sometimes they can grow and cause problems. Once these tumors start causing issues, doctors may recommend removing them. Different types of renal cancers. There are various types of renal cancers including renal cell carcinoma or RCC. This is the most common type of kidney cancer, accounting for up 90% of cases. It originates in the renal cortex or the outer layer of the kidney. Doctors can further divide it into several subtypes. Transitional cell carcinoma. Around 5 to 10% of kidney cancers are of this type. They originate in the renal pelvis, which is the center of the kidney. Doctors may also refer to them as urothelial carcinomas. Wilms tumor. This type of tumor typically occurs in children and is rare among adults. Doctors may also refer to it as nephroblastoma. Symptoms. Symptoms do not usually appear in the early stage of kidney cancer, but some people still experience them, particularly when the cancer becomes more widespread. Some symptoms of renal cancer include blood in the urine, pain in the side that does not go away, a lump in the abdomen, appetite loss, unexplained weight loss, anemia. Other diseases may cause similar symptoms. If someone experiences any of these symptoms, they should contact their doctor. Causes. Doctors are unsure of exactly what causes renal cancer, but genetic and environmental factors may play a role. In the case of renal cancer, cells in the kidney undergo certain changes. Cancer starts when there is a change in the structure of DNA in cells, which can trigger them to grow uncontrollably. Eventually, a tumor will form. The changes may turn on oncogenes, which are genes that help cells grow, divide, and stay alive. They may also turn off tumor suppressor genes, which keep cell division under control and help cells die at an appropriate time. If an individual has changes in multiple genes, this could cause kidney cancer. Risk factors. The primary risk factor for renal cell carcinoma is smoking cigarettes, pipes, and cigars. Obesity is another major risk factor, particularly among females. Experts estimate that quitting smoking and maintaining a moderate weight can halve the incidence of renal cancer. Other risk factors may include high blood pressure, chronic renal failure, occupational exposure to chemicals such as trichloroethylene, family history of renal cancer, advanced age. Staging of disease. The stages of kidney cancer are as follows. Stage 1. The tumor measures less than 7 centimeters across and is only in the kidney. Stage 2. The tumor is larger than 7 centimeters but is still in the kidney. Stage 3. The tumor of any size has spread outside the kidney. It may have spread to nearby lymph nodes or blood vessels, structures in the kidney that collect urine, or the fatty tissue layer around the kidney. Stage 4. The tumor is growing beyond the fatty layer of the kidney and may grow into the adrenal gland, which is located on top of the kidneys or nearby lymph nodes, or the cancer has spread to other parts of the body. Treatment. An individual's treatment options may depend on their overall health, the type and stage of kidney cancer, personal preferences, previous treatments for cancer. Some options may include surgery. In most cases, surgery is the main treatment for kidney cancer that can be excised. The surgeon may remove part or all of a kidney as well as tissue from around the tumor. If necessary, they may need to remove lymph nodes and other tissues. A person can function with just one kidney, so removing a whole kidney is an option. Laparoscopic surgery, which requires only small incisions, is often possible. Non-surgical options. A person who is unwell or frail may not be able to undergo surgery. In this case, some non-surgical options may be possible if the kidney cancer lesions is considered small, typically no larger than 4 cm. Cryotherapy or cryoablation. Extremely cold gases pass through a probe, creating an ice ball at its tip that can destroy the tumor. The procedure can be painful and it may cause some bleeding, infection, and damage to the tissue close to the tumor. Radiofrequency ablation. An electric current is passed through to the tip of a probe to destroy the tumor. It comes with similar risk as cryoablation procedures. Chemotherapy. Chemotherapy is the use of powerful drugs to attack and kill cancer cells, stopping or delaying the progress of cancer. Doctors may only prescribe chemotherapy when other treatments such as immunotherapy or targeted therapies have not been successful. Kidney cancer cells typically do not respond to chemotherapy, but a small number of people have benefited from it. These drugs often affect the whole body and they can have widespread adverse effects. However, The effects often subside after treatment finishes. Immunotherapy. Immunotherapy boosts the ability of the body's immune system to fight cancer. Inhibitor drugs may target certain proteins found on the immune cells of the body and modify them to attack cancer cells. An example drug which targets PD-1 protein. Cytokines, which are small proteins that boost the body's immune response, may also be an option. Common side effects include nausea, vomiting, chills, fatigue, and loss of appetite. Targeted therapy. In targeted therapy, drugs target specific functions or genes that play a role in the development of cancer. They interrupt the functions and proteins that are necessary for cancer to survive and grow. An example drug is sunitinib, which blocks angiogenesis, the process of forming new blood vessels that can feed cancer. Each drug may come with its own unique side effects, but generally these types of drugs may cause fatigue, low red blood cell counts, and mouth sores, among other effects. Radiation therapy. Radiation therapy cannot usually cure kidney cancer. However, it may help shrink a tumor, reduce the spread of cancer cells, and ease symptoms. It involves using high energy beams to kill cancer cells. Side effects typically include nausea and fatigue. Supportive care. Supportive care or palliative care can help people with kidney cancer and their families deal with practical, emotional, and physical challenges that come with the diagnosis and treatment process.